You're listening to The Q Switch with your host, Spence.
Welcome, one and all, to the Q Switch Conversations podcast. I'm your host, Spence, and the mission of this show is to tackle subjects currently impacting ophthalmology and pull in leading eye care professionals and industry players to discuss their unique perspectives. So let's get into it. For decades, cataract and refractive surgeons have owned the word premium. Their practices have long been synonymous with boutique experiences, cutting-edge technology, and personalized care. But in the world of retina, where the focus has traditionally been on acute care, volume, and urgency, the same boutique cachet just hasn't existed until now. My guest today, Dr. David Lazar, is rewriting the narrative. He's a true renegade in the retina space, a surgeon, a researcher, and entrepreneur who's fearlessly challenged the status quo by building Lazar Retina, a solo boutique retina practice in the heart of Los Angeles. He matches world-class surgical skill, peerless clinical depth, and he's got the research chops too, with credentials that span presentations at ASRS, AOP, and Harvard. Dr. Lazar combines medical mastery with an entrepreneurial spirit that's redefining what modern retina care can look like. He's not just performing surgery, he's performing a genuine and meaningful paradigm shift that's real. Dr. Lazar, welcome to the Q Switch.
Wow, Spence, thank you. That was really nice. Really appreciate the kind words. Thank you for having me on. Quite an introduction.
Well, great. So let's start with your story, Dr. Lazar. You were born and raised in Encino, trained across the country in some of the nation's top institutions, and then returned home to Southern California. What drew you back to Los Angeles to build your practice, and why land in retina and macular disease?
Right. So like you said, I'm from the San Fernando Valley, Encino. I did all of my training, left for college, medical school, residency, fellowship outside of California, because I knew I always wanted to end up back here. This is where my family and friends are. It's where my roots are. So I had no problem leaving for my training, but I knew I always wanted to make my way back here. So that's why I came back.
I was going to say, and why retina and macular disease as kind of where you kind of really specialized your training and education and all?
So why retina? That's a good question. I just kind of fell into it. It's not, I didn't know I wanted to do ophthalmology. When I started medical school, it just clicked with everything that I wanted. And I went into residency with that kind of open mind, and retina seemed the best fit for what I found interesting and the types of surgery and the pathology. And so I just went for it and was able to match it at a great program in Boston and loved my time there.
Well, good. Well, again, great personal story. And sometimes when things happen organically, that's usually that, and you answer the call, that's usually the best fit. It sounds like that's what happened with you.
Yeah, I think that medical specialties all have pros and cons, every single one. I mean, I think it's, for anyone who's going through medical school or residency, it's just a matter of finding which ones click with you. I mean, there's nothing, it's not like I dream about eyeballs and they're the most amazing. I mean, they are pretty amazing, but it's not, I came at it from a much more practical standpoint.
So let's really move on to the subject at hand. The field of retina has evolved dramatically over the past few decades. When you think about back in the 1980s and 90s, when most retina specialists operated as solo or small group practitioners, how would you describe the key differences between that era and today's landscape dominated by supergroups and private equity-backed practices?
So you nailed it. What's going on now in healthcare is that you have private equity and you have big academic institutions forming huge consolidation of medical practices. So private equity, big hospital systems like UCLA, Cedars-Sinai, and St. John's in Southern California, they're all fighting to buy up medical practices. They roll them up, they cut the overhead, and then they repackage and sell them to the next buyer. This consolidation, I think, is generally speaking not great for patients.
Mm-hmm.
Now, the physicians are great. I'm not making a comment about the quality of the physicians. I'm talking about the quality of the medical experience. Just the entire experience, the entire journey a patient has to go to, from calling and scheduling an appointment to going to the appointment to any follow-up questions that you might have. There's no doubt about it that this consolidation, these mega groups impact the quality of that aspect of healthcare. And I think that we're at really a very interesting point where I think my prediction is that private practices, the last of the solo private practices are going to thrive if we embrace that difference and really start to master delivering high quality care. I'm not talking about the medicine. I'm talking about the experience. And I think if we lean into that, I don't know any patient who wouldn't want that over a big Walmart type experience.
You chose to go against the grain and establish Lazar Retina as a solo boutique retina practice in one of the most competitive ophthalmic markets in the country. What established that decision, and what was your vision for how it could look and feel different?
So I'll answer that by first going back in time. Throughout my training, I was able to practice ophthalmology and retina in a VA system, a big hospital system, a private practice associated with a hospital system, and a big private practice with 6 retina surgeons.
Mhm.
So I saw how retina can be practiced in all these different ways, and the efficiencies and the inefficiencies. And when I started this practice, my practice, it was really simple. It was, I wanted to form a practice that I would be proud if my parents showed up and had an appointment. They would have a great experience. They would know that this was a top-notch place. And that was kind of what I had in mind when I started. I've said it before, and I'll just reiterate, that experience starts from when you answer the phone, to the aesthetic of the office, to how the front desk greets you. It's really every step that a patient goes through, I think, needs to be honed and just polished.
And we're going to get into that as well, so you can really kind of develop that
Sure.
thought.
Sure.
Before we do, let me go to my next question, which is every entrepreneurial leap comes with a few sleepless nights. What were some of the biggest challenges or fears you faced in turning that concept into reality, and how did you overcome them?
Right. Yeah, so you're totally right. There's a ton of risk that I took. The biggest risk was if you're trying to lease office space, premium office space in Los Angeles, the lease length is basically you cannot get it for less than 5 years. Okay, so you have to sign a 5-year lease. But the kicker is you have to personally guarantee the lease. So what that means for anyone who doesn't know who might be listening is that I was on the hook for the entire 5 years. So there wasn't, let's say I would start the practice and for whatever reason, it doesn't work out. I'm right down the street from UCLA. Everyone just goes to UCLA and the private practice doesn't work. Well, I personally am on the hook for that 5 years of lease rent. I can't just tell the landlord, Lazar Retina is going under, so good luck. So that, I think, was without a doubt the biggest source of anxiety, because I knew the machines that I bought, I bought all these top of the line machines, the Heidelbergs and the Optos. I knew that if things didn't go well, I could always resell those, in the secondary market. But a 5-year lease, personal guarantee, that was tough. That was tough.
So in addition to like the lease, which is obviously the largest, burden to carry, is there anything else that may be financially or market-driven factors that weigh heavily on capital costs, that may weigh on the success of the practice and how it functions and flows?
Yeah. So the way I thought about it was, for every expense that I had, whether it was an EMR or the chairs or the slit lamp or anything, if there was any way to defer payment, I tried to kick the can down the, okay? Because what I knew was, at the first couple months, there wasn't going to be a lot of patients. There weren't going to be a lot of cash coming in, because I had to be out there pounding the pavement and getting patients. So I just tried with everything that I did, including the lease payment. Actually, I said, okay, I'll sign the lease, but I don't want to start paying for X amount of months. And I would negotiate with whoever, for whatever individual thing. And I think that gave me a little bit more of a runway where I knew the payments were coming, but I had a little bit of, I had 3 to 5 months to 6 months where I could just ramp up and not have these huge crushing bills in the back of my mind.
Yes, yeah, give yourself a little bit of breathing room. Sure.
Yeah.
So you've described Lazar Retina as boutique. That word means different things to different people. So in your own words, what defines a boutique retina practice and experience to you?
Great question. I think it's simply that understanding that nothing is above delivering world-class healthcare. But what makes a boutique practice is also understanding that it's how that care is delivered and how it's explained and how the patient experiences the delivery of that care is equally as important. Not more important, but equally as important. The analogy I like to give sometimes is, if you go to a nice restaurant, a nice steakhouse, okay, the food is going to be great. The chef takes a lot of pride in producing great food and for the patrons. But if you notice, it's not like you're going to sit with dirty silverware and dirty linens, and the person who greets you at the door is going to be all disheveled and et cetera, et cetera. The quality of the environment has to match the quality of the care that you're giving. And what I think is that what I've seen in my experience is that there's often a mismatch. There might be fantastic doctors who really are just tremendous titans of medicine, but they're not operating in an environment where that can be explained and appreciated because maybe the front desk person is rude or the office is dirty or overcrowded. And I think that if you can have empathy for your patients, you can understand that it's all important. It's all important.
So I think you're kind of leading to my next question, where it sounds like you have a very intentional patient journey at your practice that's very, very different than the common experience that most other patients experience at a retina practice at some of the places you've mentioned over the course of this conversation. So take us through, like, if a patient for the first time might experience from the moment they walk in, and how you design that journey to reflect your philosophy of personalized patient-first care. What does that look like?
Well, let's just start with how the office is oriented. There is no real waiting room. It's an open concept. Yeah, it's an open concept space. It's not a traditional office space. There's glass partitions that are frosted. Very, it's unique. It doesn't look like a retina practice.
Traditional,
And
and I've seen
right,
many over the course of my career in different areas, and they all look very similar in their kind of their tone and tenor and theme, and it's very I want to say blah, but
impersonal.
it's yeah,
Impersonal.
exactly. That's the perfect word, impersonal.
And what I had in mind when I designed this, or had help, obviously, was like an open kitchen. Like when you go to a restaurant and an open kitchen. And I love that philosophy because I wanted just to take the mystery away from healthcare. Like there's no reason to hide behind walls. I want it nice and open where everyone can see what's going on. Obviously, there's privacy within the rooms, but the openness that people can see the injections and where they're going and this and that, I think is important. Just like when you go to a restaurant and you see an open kitchen, you could see how the food is prepared. You could see what's going on. You could see that it's all done in a professional manner. You don't have to guess about what's going on in the back. Is it right or not? And so when you're purposeful, there's no reason to hide all that.
Yeah, and I think along with that, as I'm following your scenario and that you're putting together, is that when you have an open kitchen or open concept, you're open to accountability, and attention to detail is key. I know that when I go to a restaurant where they have an open kitchen, I'd certainly get back there and take notice when it's like on the way to the restroom, what have you. I slow it down, like, oh, what's going on? And those guys are on point because they know they're being watched. They are leaving themselves open to, accountability.
Right.
No one can make any mistakes, or very few at that, because they know that their customers are watching, and they're inviting them into where most folks don't go. And I think it's a sense of pride, and, to know that you provide services, whether it's at a restaurant or at a retina clinic, that you're open to having people see what you do and being transparent. I think that's a great quality to have in a situation like yours, because it doesn't exist largely in your profession.
100%. So with that, in the patient rooms, I have a big screen TV, 60 inches, okay? Each room has a 60-inch TV. And when the patient sits down, their images, whether it's an Optos or an OCT, are on the screen. There's not one patient I see that I don't go through their images with them on that big TV screen. And that is part of the same concept of openness, explaining, showing them exactly what's going on, showing them their retina, showing them what's right, showing them what's not right. And these people they don't sit down and ask. They don't say, I want to see my OCT. Can you please review it with me? I could just as easily just walk in and say, all right, you look good. You have some floaters, watch out, and see you later. But I think that for a lot of patients, they want to know what's going on. And as long as it's distilled down to a digestible language, they want to know. They're interested.
I was going to say that because I see that take place on the cataract side, and when patients understand that they have a cataract, again, this has been happening in cataract for quite some time, where you show the patient, hey, you have a cataract. This is what the cataract surgery looks like, and puts the patient more at ease. They understand they're a part of their own care, and they're more engaged and more comfortable, more calm. And I think it's long time, that should be a part of what retina can offer. And it sounds like you're doing something like that now.
Certainly trying every day.
Hey, so from a technology perspective, clearly plays a role. How do you balance investing in the latest imaging and laser systems with maintaining the warmth and accessibility of a solo practice?
I will invest in any technology, no matter how expensive it is, if I feel that it helps either improve the quality of the care that I give or helps translate the pathology. So if it's, if it's educational to the patient, or if it helps me be a better doctor, I will invest no matter, unlimited dollars.
Mhm.
Not all technology though checks those boxes. Some
Oh,
technology is just, I don't think, has a tremendous amount of merit. Not So you just have to be discerning about what you're going to buy, and is it really going to help move your football, whatever it is, down the field? Is it going to help you deliver what you want, or is
mhm,
it just
mhm.
another piece of machinery that's going to sit in the corner and cost you money?
Sure. Like meaningful use, meaningful impact on patient care.
Yeah,
Sure.
right.
So, behind every great practice is a great team. Tell us about your staff and what qualities do you look for when building a team that embodies your approach to care?
I think the hardest thing that I do is not the medicine. And it's
Hmm.
not that the medicine isn't hard. It's just that this idea of building the right team and having the right people around you and training them properly, that's the key. That is the key, because I'm only in the room with the patient for X amount of minutes. The rest of the experience that I've gone on to explain is, in my opinion, so important. I have to rely on these other teammates. So finding the right people is, uh, it's just the most important thing that you could do.
Hmm.
I was lucky enough that I found an office manager who had tremendous retina experience, and all I did was slap the biggest pair of golden handcuffs on him and make sure that he's happy. And I couldn't run the practice without him. So he's my point person. Every day mistakes are made by the team, and every day mistakes are made by me. It's just a matter of catching the mistakes and addressing them and not repeating them. And then
Hmm.
eventually we will all run out of mistakes, because we'll just catch them and make changes so that they don't happen again. But to think that mistakes and don't happen is naive. It's just not repeating them that I kind of reinforce every day.
Well, it's a very humble perspective. You're surely grounded. I'll tell you, just generally speaking, most folks think most of them have like a God complex.
If you don't understand that you're flawed, you can't get better.
Sure, sure. So in Los Angeles, you're surrounded by major academic institutions and large retina groups. You could literally throw a stone from your front door and hit the site of Jules Stein Eye Institute. How do you differentiate yourself and position Lazar Retina in such a competitive environment?
Yeah, and that's kind of what we've been talking about. Is the only way to do it, in my opinion, is the experience. Because the physicians, obviously, at Jules Stein are fantastic. I know them all. They're all incredible retina surgeons. So I would never, ever say that I'm better. I mean, it would be ridiculous. It's a ridiculous statement. They're colleagues. They're fantastic surgeons. The only differentiating factor is the experience. UCLA, Jules Stein is a big, big behemoth. It is not a small, open concept, open kitchen, kind of place. And that's not, I'm not being disparaging. It's just they're different models of delivering care. So one easy example: if a patient sees me in my office and they have a question, okay, they email me. It's on my card. They email me and I write back, or they call the office and I pick up the phone. It is
Hmm.
exceptionally hard to do that at UCLA. Again, has nothing to do with the quality of the surgeons. The size and the structure of their organization just makes it impossible for them to provide those services. So there's just little things like that that might seem trivial, but if you're the patient and you've lost vision, they're not trivial. They're actually really important. So that is in my opinion, the differentiating factor.
So let's shift to outcomes and patient expectations, which govern and determine much of a practice's success. Today's patients are more informed and often have higher expectations than ever before. How do you set realistic goals and maintain trust while still offering hope and innovative solutions?
Wow. That's a really, really good question. Let me think about that for a second. I think that, okay, this is not going to be a shock, but the way I try to talk to my patients is with the utmost transparency. So, for example, some physicians, when they talk about disease states and possible outcomes, will oversell and underdeliver, or undersell and overdeliver. They'll either make this scenario more dire than it is, in order to kind of lower the expectations, or the
Hmm.
opposite. They'll kind of trivialize it to put the patient at ease. Do you follow what I'm saying?
Yeah. I got you. Yeah, that's great.
I,
Great analogy. Okay.
I think that what should be done is just to say exactly what it is. Don't say, don't kind of downplay it. Don't, and don't undercut it. So for example, let's just say a patient comes in with a retinal detachment. Okay. You'll say, you have a retinal detachment. This is something that we fix for a living. It comes with a 90% chance that this gets fixed with one procedure, but it is very serious. And we need to take care of it. The post-op period will look something like this. But whenever you feel overwhelmed, just understand that if you're going to pick a problem in medicine to have, you picked one that has a 90% chance of being fixed with one procedure. So it's a matter of staying positive, okay, but also realistic, and also making sure they know this is serious. You can go blind, but we're going to get it done. And I'm going to be with you every step of the way. Something like that.
Well, I think generally speaking, across all medicine, ophthalmology included, that patients, again, being more engaged, more astute, more informed, they know more than than they did 10, 15, 20 years ago. So I think on the level, you can be honest with them and they appreciate it. They feel respected and, valued as a patient if you just simply level with them. Good, bad, or indifferent, that's what most patients want, so they can, deal with it. Obviously, there's some that, on the fringes that probably don't. But I think on the whole, most patients want you to level with them, no matter what the diagnosis is, so they can, again, follow that diagnosis up. And oftentimes in retina, it's a negative one with retinal detachments and all that. They say, you know what, this is your situation, but here's our solution. Here's how we're going to fix it. And I think patients really appreciate that in this day and age of medicine.
I think you're probably right. The problem is there's so much out there that isn't accurate.
True.
I'll give you an example that I come across all the time with retinal detachments. Someone will come in with a retinal detachment and they'll say, I read online that this is an emergency. Shouldn't I go to the emergency room? And I have to say, I'm not going to go into the literature and talk about this study and that study, because it's just too much for these people. They're already worked up. They're scared. I don't need to throw all that stuff at them. What I say is, well, there's a difference between urgency and emergency. Okay. And retinal detachments are urgent. They need to be addressed in a timely manner, but they're not, with few exceptions, emergent. And that's kind of a bit that I've developed over time that allows us to kind of diffuse the anxiety around it without spouting off about like, this study proved this and that study proved this and macula on or macula off and blah, blah, blah. So I find it to be something I unfortunately have to explain too much, because people come in and they Google it and they think that if they don't have surgery within 20 minutes, their head's going to explode. So they are informed, but the but the quality of the information isn't always good.
I'd imagine that if you had a nickel for every time somebody said, I read online, fill in the blank, you'd be a rich man by now.
100%. And I'm the same way. Once I hear I've read online, I just can't wait for what comes next.
So you're also an expert level clinical researcher and investigator in national trials. How does that involvement influence the level of care you're able to deliver in a private boutique setting?
So my experience with clinical trials has kind of slowed down since I started my own practice. It's very meaningful. Clinical trials are very, very meaningful. They're very important to advance patient care. Unfortunately, they are very, very cumbersome. They require a tremendous amount of overhead. They've become very bureaucratic. There's just a lot that goes into it. I don't feel that that clinical trials necessarily fits with the style of care that I deliver here. For a clinical trial patient, they might be in your office for 2 to 3 hours from start to finish. Yeah, because you need to do the imaging, you need to do the history, you need to take blood, you need to do this, depending on the phase of the clinical trial. That's just not possible to have those types of patients who require that much time, while also giving time to my clinical patients who require time too. So although I've done it in the past, the clinical trials and all that, and I'm open to doing it in the future, maybe with an associate, for right now, my goal is just to deliver world-class care, clinical care.
Well, I know it's something you've been passionate about in the past, and hopefully you get back in the game at some point when the time and opportunity is right for you there at Lazar Retina. So, and finally, let's end with some of your homespun advice. If a young retina specialist came to you today and said, okay, Lazar, I'm thinking about starting my own solo retina practice following your model, what would you tell them, both words of encouragement and words of caution?
Words of encouragement are a great decision. It's very meaningful. Being your own boss and delivering care the way you kind of envision it is very, very meaningful. And treating patients is meaningful too. But being able to be in control of the whole package is just, it's additive. I don't think there's any caution. I think the smartest thing I did was just don't spend, keep your overhead low. Keep your overhead low. Don't overhire. Yeah, be lean. Don't overhire. Don't start off with a billing company. I did all my own billing. If there was anything that I could do, any kind of, I did it to save money in the beginning. And I deferred all these payments. And I think that if you go in without that kind of long-term thinking, you could end up spending a lot of money up front. And I'm sure people will be successful, but it's going to be a lot of down months. It's going to be a lot of months where you're in the red. And that could be very, very scary. So I think that don't go broke is probably the best advice I could give.
Okay. I did have one more question that I think is quite something I really would like you to answer for me. So when looking ahead, do you believe that boutique retina model is sustainable and scalable? And what do you see as the biggest opportunities and challenges for retina specialists who might want to follow this path?
So I think it's the only way. I think it's the only way if you want to be in private practice, because as we talked about in the beginning of the podcast, all of these mega groups are happening. All this consolidation is happening with private equity and with the hospital systems. So the only way to compete against that is to offer something that they don't offer. That, in my opinion, assuming that the medical care is all equivalent, which is the assumption I'm making, the only way to compete is to deliver the care aspect, the experience, to make sure that just like when you go to a nice restaurant and it's, the chairs are comfortable and this and the waiter's nice and everything, all that's what was once considered soft stuff, not important stuff, you can compete at that level. And again, I've said it before, and I just think that it's very important. I think that with retina, with ophthalmology, we're dealing with people's vision. They're often very scared. They've lost vision. And anything that you can do to make that whole experience through their treatment less scary is part of treatment. That's part of the treatment. Okay? It's not just the surgery. It's not just the shot. It's not just the laser. It's the whole thing.
I will say from your lips to God's ears, man. So Dr. Lazar, this has been a fascinating look at what it means to blend old school independence with modern innovation in retina care. Your insights on practice design, patient experience, and the future of your specialty really give a lot of people something to seriously think about in an ever-changing eye care landscape. I'm quite confident that you've gotten a lot of people's attention in our audience today. So if you have, if any of them wanted to reach out to you and start a conversation to learn more about your practice model, what is the best way to contact you?
My office email address is office@lazarretina.com.
Well, cool. Well, thanks for sharing that. Thanks again for joining the show, Doc. It's been a pleasure having you on.
Thank you, Spence. Appreciate it.
So as always, everyone, we'd like to thank Riverside FM and Passionate Media for making this show happen. And of course, Meridian Medical for making it all possible. That's a wrap for this episode of the Q Switch Conversations podcast. Until next time, I'm Spence and I'm out.
You're listening to the Q Switch with your host, Spence.